One of the main procedures performed at Wright Surgical Arts is that of facial cosmetic surgery. My philosophy in facial cosmetic surgery has to do with the aging process. Those processes can be defined by the 3 Ds of aging. The first D is descent of the skin and the muscles of the face, deflation of the skin as well as fat surrounding the face, and thirdly, deterioration of the skin, meaning wrinkles, sun damage, and sunspots. All 3 of these Ds must be addressed to give you the very best cosmetic surgery outcome. Descent of the tissue is defined as sagging eyebrows, loose eyelid skin, loose mid-face muscles accompanied by loose skin and sagging cheeks, jowling, and loose neck skin. In these preoperative photos, you can see the descent of the cheeks, the more pronounced and deepened nasolabial folds, sagging jowl, loss of definition of the jawline, and loose neck skin. Problems like these can be corrected with brow lift to elevate dropping eyebrows, eyelid surgery to remove excess skin, nose surgery, correcting the tip of the nose and rejuvenating its appearance, and facelifting to soften those deepened nasolabial folds, correction of jowl, tightening of the jawline, and elimination of platysma bands. Now I would like to talk about deflation of the skin. Deflation of the tissue can be defined by hollowing of the eyes, sunken cheeks, hollowness around the mouth, as well as thinning of the lips. In this example, you can easily see deflation of the face. You can see hollowness around the eyes and the eyebrows, especially underneath the lower lids, and around the cheeks. You can also see the hollowness around the mouth and what we call the prejowl sulcus and the nasolabial folds. These areas can be easily corrected by different techniques. The first technique is fat grafting. We do this by taking fat from one area of the body. We then treat that fat and inject it into certain areas of the face. This technique requires artistry and sculpting to create the best result possible. The second technique would be using facial implants. Examples would be cheek and chin implants, restoring lost volume and creating better projection or height, helping to restore elegance to the face. Other more simple ways to do this is with what we call fillers. This can be done with an injectable filler often thought of as collagen or what we call hyaluronic acid. These fillers are produced and manufactured and then put into syringes. With these syringes, we then inject the filler into areas of the face that we feel need it. The advantage to these products is that they don't require surgery and it can be done very easily and somewhat inexpensively in the office without much downtime. This is also very artistic, and I personally do this myself. Some places do this with a nurse, but I feel that it is very important to have the doctor inject these to have them done properly. Another very simple procedure we do frequently is injection of Botox or Dysport into the forehead, between the eyebrows into the 11 lines, the wrinkles around the mouth, and the crow's feet. These injections help to eliminate wrinkles that can form in these areas. The third D is deterioration and is the final critical component of the aging process. I find deterioration is sometimes the first thing that needs to be repaired in facial rejuvenation before any descent procedures should ever be completed. It takes a thorough evaluation to make sure which one of these Ds needs to be done first or if they can all be done together. Deterioration is mainly defined by wrinkling or breakdown of the skin. It can also be defined by pigment, red spots, brown, and even black spots in the skin. This deterioration occurs by either the environment, your hereditary descent, or most commonly, sun damage. Treatment includes lasers for rejuvenation and resurfacing, as well as appropriate skincare. In this photo, you can see that this particular patient has severe wrinkling. You can see that the wrinkles are at rest. During animation, they can get deeper. You can also see some precancerous lesions. You can see red spots and some brown spots within the skin. This type of skin typically requires a more aggressive approach. In this particular patient, I would recommend doing a laser resurfacing procedure first before any type of surgery is contemplated. This will not only improve the surgical outcome, but patient satisfaction as well. At Wright Surgical Arts, we have a state-of-the-art laser center and med spa. We can do anything from mild photo damage to severe photo damage. Depending on your consultation and the type of skin that you have, we'll determine what type of laser we will use. Certain lasers can only be used by an experienced surgeon or physician, and other lasers can be used in the medical spa by an experienced master esthetician under the supervision of a physician. I look forward to meeting you during your consultation, discussing with you your facial rejuvenation, and creating a plan that best fits your needs and wants.